Thank you very much, Honorable Minister for Health, distinguished high-table guests, distinguished guests, ladies and gentlemen. A very brief presentation from Ghana. 5 minutes will be woefully inadequate to make any meaningful presentation, but we'll do the best we can. Central to the discussion or presentation that we heard on universal health care by the WHO rep is the element of financial risk protection. Without universal financial risk protection, it may be extremely difficult to achieve universal health coverage, particularly in the sense that the whole idea is to address the challenges of the poor, the underprivileged, the marginalized in society. The key element here then is to perhaps consider the provider-payer split as a most potent strategy going forward. Key points: population coverage, and in population coverage you want to look essentially at addressing the health concerns and financial concerns of the poor and those living at the margins of society. And benefit package. In Ghana we have a very huge benefit package. The lessons in Ghana show that it is important to begin with a modest benefit package and grow the benefit package as you develop enough fiscal space and ability to fund the system. Financing. So for the key points, we're looking at population coverage, benefit package, and financing. Ghana has adopted a hybrid strategy of financing, combining both the classical social security arrangement and the tax-based arrangement. So we have a national health insurance levy, which is a VAT, 2.5%, and earmark funding, 2.5% assigned to the health insurance fund, together with 2.5 percentage point of social security contribution, and this feeds into the health insurance fund to at least enable us carry on with the mandate of ensuring financial risk protection. Recommendations. We have 4 recommendations here. 1, strengthening the health system. And in strengthening the health system, essentially to achieve universal health coverage, you must have a robust health system. In strengthening the system, essentially we would want to look at health infrastructure and equipment, human resources, pharmaceutical supply, and here there is an emphasis. If the pharmaceutical supply chain is inefficient, what it means is that government will pay for the inefficiency through the financial risk protection medium it would create. The second recommendation is to develop perhaps pro-poor exemption policies. In Ghana, all under 18 years are exempt from the payment of premium, and all 70 years and above are also exempt from the payment of premium. Again, indigents, or the poor for that matter, are exempt from the payment of premium. And we also have expectant mothers or pregnant women exempted from the payment of premium. And until recently, we have also included mental health patients and differently abled, or call it physically challenged, also exempt from the payment of premium. Again, as a result of SNAID contribution of 2.5 percentage points assigned to the health insurance fund, SNAID contributors are also exempt from the payment of premium. This is a strategy that is currently under review. Whether to have SNAID contributors exempt from the payment of premium is an issue that is currently under discussion. But today, as it is, SNAID contributors are exempt from the payment of premium. And 3, sustainable sources of revenue. That's the third recommendation. Do we want to have earmark funds, which always becomes a struggle between the Ministry of Finance and the Ministry of Health? Do we have the political will to have earmark funding? It takes strong political decision to achieve that. Do we want to have social security contribution as against employee contribution, or both? Which of the two would we want to apply? It also requires some negotiation with the Trade Union Congress and employers to determine which is most feasible and easily doable. And the final recommendation has to do with political commitment and leadership from government. Without political commitment and leadership from government and direct from government, from the source of power, it is extremely impossible to take any giant step as far as achieving universal health coverage and by implication achieving universal financial risk protection is concerned. 4 experiences we want to share. One has to do with the benefit package. As I said earlier, if we are to roll back in Ghana and commence the whole exercise of establishing a health insurance scheme, one of the key things we would look at is a benefit package. We will not roll out a huge benefit package as we have now, we have always shared this with all who have come to Ghana to share knowledge with us on health insurance, that it is extremely useful to begin with a modest package. 2 is the payment method. We have various payment methods or provider payment mechanisms, whether it's fee for service, whether it's the diagnostic related, groups approach, capitation, and a host of others. One would want to suggest that in the light of the experiences that we have, it is extremely important to begin with capitation as a provider payment mechanism, because it becomes extremely difficult to introduce capitation midstream. Our doctors are very, very powerful. They have a strong lobby and a strong union, and it doesn't really matter whether they are right or wrong, I'm sorry, but when they take a position, it becomes so binding and so difficult. And it is in that respect that perhaps commencing with capitation at the outset becomes extremely important. The third experience we want to share is that in generating membership cards as a basis for accessing healthcare, it is extremely important to begin with an instant issuance of ID cards based on biometric data, rather than having ID cards issued or maybe having a registration process where you register, having data transmitted to the center, printing cards, and then going back to distribute. It simply does not work. With instant issuance based on biometric data, you are also able to vouch for the integrity of your data. And finally, the lesson is that of ICT infrastructure. It is important to clearly understand and define your operational architecture, understand it clearly before implementing an ICT infrastructure. The difficulty here is, perhaps as our experience shows, you have a huge ICT infrastructure which does not really sit well with the operational architecture, and which requires a lot of resources to tweak in order to meet your expectations. Essentially, these are a few that Ghana can share with you, but I believe that in the question and answer time, we'll have the opportunity to elaborate on most of the issues that we have raised. Thank you very much.